This is the posterior to anterior mobilization of the spinous process. In this mobilization, the patient is positioned in prone, with the therapist positioned to the side of the patient. It's important that the patient is comfortable, so it may be necessary to use a pillow beneath the patient. Therapist's cranial hand contacts the spinous process, while the caudal hand reinforces the cranial hand. The ulnar border just distal to the pisiform is a good contact point. The therapist takes up the slack in the joint and progressively delivers 3 slow repetitions moving to end range. The purpose of this mobilization is to assess for backward bending mobility of the thoracic spine, as well as to assess for pain provocation. It is the inferior glide of the facets that causes this backward bending motion. This is the posterior to anterior mobilization of the transverse process. It's the caudal hand, second and third fingers that contact the transverse process of the vertebrae. The caudal hand makes a peace sign, and the cranial hand reinforces and provides the force of the mobilization. The therapist takes up the slack in the joint and progressively delivers 3 slow repetitions moving to end range. Note that the direction of force is perpendicular to the spine. The purpose of this mobilization is to assess for forward bending mobility of the thoracic spine, as well as to assess for pain provocation. It is the superior glide of the facets that allows for this forward bending motion. This is the mid-thoracic thrust. The patient is positioned in supine with their arms crossed over their chest. Ipsilateral arm should be crossed underneath the contralateral arm. The therapist is positioned facing the patient with their mobilization hand at the transverse processes at the level to be manipulated. The therapist's hand position should either be a clenched hand or a pistol grip, using the third MCP and the thenar eminence as a balance point. The therapist will use the patient's breathing to facilitate the mobilization and will time the thrust with the patient's exhale. The therapist will flex the patient's thorax by supporting the head and upper trunk until tension is localized to the desired segment. The therapist will deliver the thrust towards the table and somewhat up towards the patient's head. The therapist will lean into the patient's arms with their sternum, take up the slack, and deliver the thrust. This is the seated cervicothoracic thrust. The therapist positions a towel at the desired level and threads their arms through the patient's hands placed behind their head. The therapist compresses the towel wedge between their chest and the patient's trunk and asks the patient to draw their elbows together. While maintaining this compression, the therapist leans slightly back and delivers a quick thrust with their legs in a vertical direction.